A chaperone is an impartial observer of a consultation that involves an intimate examination. He or she is there to support the patient. Having a chaperone present during an intimate examination can be very reassuring to the patient. It also provides a safeguard for the patient and can discourage unfounded allegations of improper behaviour against the doctor. Ideally, a chaperone should be a healthcare professional who is familiar with the procedure to be carried out. It could also be a relative or friend of the patient, although the GMC guidance on intimate examinations and chaperones warns that it would not necessarily be an impartial observer. However, you should comply with a reasonable request to have a friend or relative present. As one of the purposes of a chaperone is to protect the patient from vulnerability and embarrassment, the chaperone would usually be of the same sex as the patient. They should also respect the patient's dignity and confidentiality at all times and be prepared to reassure the patient if they experience any discomfort or distress during the examination. The GMC also requires that they should be prepared to raise concerns if they are worried about the doctor's behaviour or actions. A chaperone can have other functions too, such as translating for the patient if there is a language barrier. The chaperone should remain present throughout the examination, but once it is over, they should leave the room so that the patient and the doctor can discuss the findings and clinical issues confidentially. Wherever possible, you should routinely offer a chaperone for any intimate examination. This applies to both female and male patients, and regardless of whether you are the same gender as the patient. By intimate, we mean, of course, examination of the breasts, genitalia or rectum, but also any examination where you need to touch or be close to the patient. For example, an examination of the fundi using an ophthalmoscope when it is necessary to darken the room. If the patient is a child or vulnerable adult, then it is always advisable to have a chaperone present. A parent or carer may be able to act as a chaperone in this situation. Patients have a right to refuse a chaperone if they really don't want one, but if you don't want to proceed without a chaperone being present, or if either of you are uncomfortable with the choice of chaperone available, then you can offer to delay the examination to an alternative time, when a different chaperone or even a different doctor is available. This course of action must be compatible with the patient's best interests and clinical safety. We advise members to document the offer of a chaperone in the patient's notes and whether this was accepted. If a chaperone was present during an examination, then you should record the name of the chaperone. Most GP computerised record systems have read codes to facilitate the recording of this information. If you need advice about any specific clinical situation and the use of chaperones, then please contact the MDU advisory team.